So I want to talk today about a grant that I worked on, which was developing a skills-based instrument to measure health literacy. And so it was a team of people that primarily were at RTI, which is where I work, but we also had people from other institutions, some of these names that you might know, who've done a lot of work on health literacy and patient communication, and we had a really nice team of people who brought a variety of skills to the project. So our objective was to create this publicly available health literacy skills-based assessment instrument that could be used for large population-based surveillance or interventions for research studies. This wasn't designed to be sort of something to be used by clinicians sort of on the fly or whatever for a short. This was more of a larger instrument, and it was sort of in response to the instruments out there that we thought were just measuring just reading literacy and numeracy. We wanted to expand beyond that. There was also another instrument out, the Now, that some of you might know, that we thought was probably good, but it wasn't publicly available, so that was why our impetus for this. So we had this very nice sort of a grant where we had sort of the leisure to sort of start at the beginning and go through to create the instrument. And some of these issues we've already talked about that we considered as part of the grant, but I'm going to run through some of this quickly. So we started out by just thinking about what is health literacy, and we did an analytic framework, and then we created the instrument based upon that. So we started out by thinking about what is literacy. So, I mean, that was really the way to start, that health literacy came from literacy, and I think you all can appreciate this, that the definition of literacy has changed over time. Sort of, at the beginning of when the U.S. was founded, you just had to make an X on a page. That was literacy. So then as the Industrial Revolution came on, whatever, people had to learn how to read and write. So the thing that comes from that is that literacy changes over time. So the demands of what's considered literate changes over time. And so that we were thinking about so that health literacy, you can expect that to change over time as well. So I worked on a paper where I identified there's 13 definitions of health literacy in different studies. So they go from, most of them are based upon the individual, like we've been talking about today, what are their skill levels, but some people have been doing some work in the idea of public health literacy. So what are the skills of the community? How well can the community react to its public health concerns? And again, it's in relation to the demands of the healthcare system. And then there's this issue, is it static or dynamic? So getting back to this issue of sort of relating it to literacy, you think someone has a level at which they can read. This is their literacy level, and as an adult, it's pretty constant. You wouldn't expect it to change unless they do a lot of adult education. So that's static. Health literacy would be the same thing. There's some people, Zerkadoulis was someone who was talking about the idea of a dynamic health literacy, and I think we were talking about that yesterday, is if you have an intervention, is health literacy changing, their level of health literacy from the beginning, before the intervention to the end, but most people think about health literacy as static. And we considered it not patient-centered communication, that was a whole other aspect of things. I think a lot of the conversation here is we're talking about patient-centered communication, how well are the practitioners actually communicating with the patients. We sort of separated that out for this project because it's messy to get into this. So the most common definition that people use is this Ratson and Parker definition that was used by the IOM and healthy people, the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. We sort of took the time and we tweaked it. We stayed pretty much with this definition because we thought this was the main one used. So we changed it, understand and communicate, because we were interested in oral health literacy, adding that in. To make informed health decisions that we thought appropriate was sort of annoying. It didn't have the cultural competency. I mean, it was value laden is what we were thinking about that. So we tweaked this. Let me go back though. So actually, after having done this, is sort of an interesting exercise, and it's interesting to think about health literacy, and I think the conversation today. But as we move on, I'm not sure how much it mattered in terms of this definition, in terms of the relationship between the definition and the instrument, and the way you think about health literacy in terms of the skills. I don't know how much was added to the definition. Anyway, so we did this analytic framework and conceptual model, which I think is interesting and helps sort of parse this out. So it's what do people bring to the equation of their health literacy. So their demographic characteristics, their individual resources, which is their education and their background, sort of their cognitive abilities, and then their prior knowledge. Part of trying to put a model together about health literacy, I think, is saying, where am I going to put knowledge? Particularly when you have a chronic disease, where does knowledge fit? And we sort of created it as sort of this feedback loop. It's sort of it's adding to your health literacy, and it's sort of coming around. You sort of have experience with your health behaviors or whatever, and it comes back around. And here our skills are we're focusing on print numeracy, communication, and information seeking. So it's, can you use the web? Can you use different tools to find out what you need to know? The demand of the health-related stimuli, that's some of the conversation we've had, sort of how well is the information sort of produced that you have to deal with, how gobbledygooky is it, you know, and how well is the presentation. And then the mediators are things like your motivation, your self-efficacy, your adherence, your social support, your emotions. And so we separated that out. That's only going to affect, so even though you seem to have the skills for health literacy, sort of your emotions and how they play out in your relationships will affect your eventual behaviors and your outcomes. So, and then this is the ecological influences. So all of this is how well is the practitioners train, what is the information, what do you have to do in the healthcare system? And I think some of this is what we've been talking about here, sort of how do you change the practitioners, but we were focused on the patient, on the individual first. Okay, so again, so there's the skills that we developed were the reading, the math, the navigation, and the oral. That's what we were focusing on. And so the operational, we operationalized those as part of the instrument. So could you understand health-related concepts? Can you interpret tables, charts, and symbols? Can you complete some calculations? Can you use the internet? And can you make inferences from information? So that was our goal, was to test that. So we were going to measure people's ability to use different modes of presentation of information to make decisions. We're going to include skills needed across the life course. So a variety of things people would need to do, both prevention and self-management. It was oriented towards the U.S. healthcare system. So of course we got into issues of insurance and do people understand how to understand their insurance. And the idea that even though we were creating stimuli for this instrument, thinking that it was going to change, that this was not something that was going to just sort of go on forever, be the best instrument, because what people's needs were going to change over time. Okay, so it's computer-based instrument, 25 items. I have here, there's 5 print prose, 8 print document, 4 quantitative, 4 oral, 4 on the internet. And the idea was that anybody could take this instrument. You didn't have any prior knowledge. We were really concerned about this issue. It's hard when you're creating an instrument, the issue of knowledge and prior knowledge, and how do you keep people from answering your questions just because they know it from before, to really test what they can do. We wanted to try to use plain language techniques. We're trying to minimize this issue of what people have to deal with. It's just so impossible to understand. So when you're creating stimuli, sort of what do you use as a stimuli? Do you use good stimuli? Do you use the most horrible stimuli? Well, we tried to keep it simple if we could. Range of difficulty, pretty quick to use, and that it cognitively tested well, and we tested it on a panel of participants. So the next part was just to give you some idea of what this instrument looks like, and it's publicly available if anybody wants to use this on the RTI website. So here are some of the stimuli. So we have this text table information on cholesterol, and then after that there's some questions in terms of people's interpretation of that table. Here's one that I particularly like. Can you read a map? Can you get to your appointment? We ask questions about how to use the map to get to the appointment. Here's one, a medical record. Can you understand your medical record? Can you answer questions based upon the medical record? And then we, because it was a web-based tool, we could do some interactive things, interactive questions. So chance of a heart attack. So there's first, here we make, we give you sort of the hypothetical person. This is who you are. This is your situation. And then you go to this interactive website, and can you take that information? Can you fill these things in? Can you enter these things in so that at the end you can calculate your risk? So can you do that? Can you use these things that are available on the web? Here is the understanding of over-the-counter medication labels. Can people read those? Can they answer questions on that? We also, oral is really hard to test. How do you sort of put that in an instrument? And the way we did this was one of those, I don't know what you call them, sort of the chain of when you call up one of those things, do 1 for this, do 2 for that, trying to get through that whole rigmarole. We asked questions about that, like what number do you push if you want to talk to the doctor, those kinds of things. We also had these video clips, so you could play the clip and then listen to the clips and then answer the questions based upon the clips. Of course, it's a U.S. Healthcare system, so we had to ask people to see if they could read an EOB, an explanation of their benefits, and answer some questions off of that. Nutrition label, this was really hard. People had a really hard time with these and trying to answer questions from a nutrition label. This is trying to get graphs. Can people answer questions based upon graphical information? And that's it. That's what we did.
Great.